When someone suffers a cardiac arrest, their chances of survival increase dramatically if CPR is started immediately. Raising awareness and providing more people with the training and confidence they need to restart a heart is vital and will ultimately save more lives. Hi, I'm Paul Deves, the Managing Director of the Hive Collaborative. My company can offer your company a full range of safety and human resource related products and services. One of our specialities is workplace first aid training. This service is also available to the general public as well. In this video, our CEO and head trainer, Dr. Emma Poyner, is going to demonstrate how to conduct CPR effectively.
Hi, my name's Dr. Emma Poyner. I set up the Hive Collaborative to provide first aid training delivered by people who've actually done it themselves. Today I'm going to give you a demonstration of what to do if you come across somebody who is unconscious and not breathing. Obviously, watching this video doesn't replace actually having a physical go with the mannequins, so I would urge you to book a first aid course to complement what you learn today.
You may not feel confident performing CPR if you haven't been trained, but without your early intervention, the chances of someone surviving a cardiac arrest are virtually zero.
I'm going to demonstrate what to do if you come across somebody who's unconscious and you think may not be breathing. You need to make an assessment, and what you need to remember is Dr. ABC. So the letter D stands for danger. First of all, check there's no danger in the area before you approach the casualty, because if you become a casualty yourself, there is no one to help this person. R is for response. Is the person conscious? Check this by speaking to them initially, and if they're not responding, gently tap them. Say, hello, hello, can you hear me? Hello? There's no response in this casualty. The next thing I'm going to do is A, check the airway. I'm going to put 2 fingers under the chin, 1 hand on the top of the head, and tilt the head back. This is going to bring the tongue up and prevent that from flopping back and occluding the airway. At this point, I can check whether the person's breathing by putting my ear right close to their mouth, looking, listening and feeling as to whether they're breathing. I'll do this for no more than 10 seconds. If there's no signs of breathing, or if the person is not breathing completely normally, you assume that they're in cardiac arrest and we start CPR. If we start CPR straight away at this point, we're going to become really tired. We need to make sure help is coming. So ring for an ambulance. You want to tell the ambulance control centre that you've got an unconscious person who is not breathing and you're starting CPR. You also want to send somebody for the AED, which is the automated external defibrillator. Whilst you're waiting for that to come, you need to start CPR. So expose the person's chest. Obviously, if you're in a public place, try to make sure the person is dignified. Perhaps use bystanders to get people out of the way so that nobody's watching. But use your bystanders as well. If they've got first aid training, you're going to need all hands to help, because it's very physically exhausting. You want to put your hand in the centre of the chest between the nipple line, flat of one hand, interlink the other hand, go above your casualty, and you want to press down about 1/3 of the level of the chest, which is around 5 to 6 centimetres, at a rate of about 120 beats per minute, which is 2 a second. It's quite fast, so I'll demonstrate. One of the advantages of using a mannequin is that you can hear that click, so you know if you're making effective chest compressions. But it's well known that the longer you do this, the less effective your compressions can be. Okay, so we've given some chest compressions. We now want to do some rescue breaths. So again, making sure the person's airway is open, squeeze the nose and put your mouth around their mouth, making a good seal so that you can see the chest rise. It should take equal time to inflate the chest and allow it to deflate. If you don't want to do mouth to mouth, or perhaps the person's vomited or has blood around their mouth, it's perfectly acceptable just to do chest compressions, and these should be continued constantly. So as soon as you've done your rescue breaths, back to chest compressions. And you need to keep doing this until either help arrives, the person starts to show any signs of life, so perhaps flickering of their eyes or movements, or you become exhausted. Whilst we're doing CPR, that's just maintaining someone's circulation until the defibrillator arrives. The defib is the thing that's going to be able to get the heart back into a rhythm. A defibrillator can be found in many places across the community, and they're all designed to be used by anybody, even if they haven't had any training. But you will feel so much more confident if you had an opportunity to actually practice with one of these. As soon as the AED or the defibrillator arrives, it takes the priority because this is the thing that may get the heart started again. There are several different models, but they all work essentially the same.
Analyzing heart rhythm.
Once you open it or press the on button, it will talk you through instructions as to what to do. It will ask you to place the pads on the person's chest and then follow the commands on the defibrillator. A defibrillator will not shock somebody unless they are in what we call a shockable rhythm, which means that they have the rhythm that will be helped by electricity. It is not possible to shock anybody else, so if somebody is not in that particular rhythm, the defibrillator will just monitor, it won't use a shock. Equally, it's not possible to harm anybody else. If they were to touch the casualty while the machine is analysing the rhythm or before it's about to give the shock, that person will mainly interfere with the very clever system that the defib has. It's constantly monitoring and it will only shock that specific reason. So if I touch the casualty, the machine's going to get confused between the casualty's heart and my heart, and therefore the safety mechanism will kick in, it won't shock, and unfortunately that means that the person who needs it will have a delay to the therapy that they need. Once you've delivered a shock, you will probably be asked to go back to do CPR. So just continue, follow what the AED or the defib tells you until help arrives or you become exhausted. There's nothing better than actually having a go with real training defibrillators and real mannequins, so you really get a feel of what to do should this ever happen. Many thanks for watching, we'll see you again.
Hi, I'm Ian, paramedic with the ambulance service. This is just to reinforce how crucial pre-hospital CPR can be. Remember, 30 to 2. Remember, you are vital in the chain of survival. Saving time saves life. 30 compressions, 2 inflations. Thank you.
If you like this video on CPR, please hit the like and subscribe button now to be notified of future videos. Alternatively, if you'd like more information about us, give us a call 01352 781 965 or send us an email hello@hivecollaborative.co.uk or visit our website www.hivecollaborative.co.uk. Thanks very much, catch you on another one of these real soon. Let's work together to increase the survival rate of out-of-hospital cardiac arrests. Book your CPR training today.